Well, hello everyone, and welcome to this webinar on COVID vaccination for workers in the disability sector in New South Wales. My name's Angus MacFarland. I'm the Assistant Secretary of the Australian Services Union, which is the major union for disability workers in Australia and in New South Wales. I'm delighted to have with me today Dr. Jan Fizzell from New South Wales Health, and I'll introduce her a bit in a minute. But first, I'll start by acknowledging the traditional owners of the land on which we meet virtually today and pay respects to elders past and present. I am in Redfern on Gadigal land of the Eora Nation, and I acknowledge all First Nations workers and participants in the sector who might be joining us and watching this webinar today. So as I said, I'm joined today by Dr. Jan Fizzell. Dr. Fizzell is the Senior Medical Advisor in the Office of the Chief Health Officer in the New South Wales Ministry of Health. You may have seen Dr. Fizzell before. She's a regular appearance on the New South Wales Health webinars on COVID and vaccinations. And thank you so much, Dr. Fizzell, for joining us today.
Really happy to be with you.
So today I'll just go through what we're going to cover. This is specifically on the requirement for disability sector workers in New South Wales to have a third or booster shot. And I'll ask you a bit about the terminology in a second, actually, Dr. Fizzell. So we'll talk about the effectiveness of the boosters, why they're important, and in particular, I'll put to Dr. Fizzell your questions, the frequently asked questions that we are getting about third doses or booster doses. I should say that the information we're having today is accurate, I guess, as of May 11, because you might be watching this into the future as it sits on our website or is shared across the sector, and advice can change. So it's accurate as of today. It's also general advice, and if you have particular questions about your circumstances, you should see your GP or health service local to you. It's also focused on the public health order for New South Wales disability sector workers. But I should say, I think if you are a worker that is in broader community services and just would like information about boosters, I'm sure you'll get some answers to those questions as well today. And lastly, if you have questions or concerns around what these mandates mean for your employment or what your employer is doing around implementing them or talking to you about them, obviously you can contact us as your union through our regular channels, our info line, info@asu.org.au, or our call us on 0293104000 if you'd like industrial advice and support. We're not going to get so much into that today. Today we're just sticking on the health advice for our members and for any worker in the disability sector in New South Wales. So let's kick off. Dr. Fizzell, I'd love you to start by kind of just going over what the requirements are as of today for workers in disability services in New South Wales to be vaccinated.
Sure. So one of the things that we've all learned through this COVID-19 pandemic is that there are a number of people who will have a worse outcome from having COVID than others. And one of the groups that's been disproportionately impacted by COVID are people with a disability, but also people who care for people with a disability, simply because there's often lots of close contact between yourself and your clients. And there's often difficulties sometimes with wearing a mask, because sometimes people have a hearing impairment or sometimes people just don't tolerate them on their faces. So we know that people in that workforce can also be at higher risk of getting COVID. Now, the chief health officers of all the different states and territories sat down together to say, is there a particular issue for people with disability and their carers what can we do to try and help protect them? And one of the things the chief health officers through the Australian Health Protection Principal Committee did was to say, disability workers need to have not just that primary course of vaccination, which is usually 2 doses of either Pfizer, Moderna, AstraZeneca or now Novavax, but they should also have a booster dose. And one of the reasons why we say you should have a booster dose is we have learnt. And one of the big things about COVID is it's still a really new disease and we are learning all the time about it. And what we have learnt about COVID is those first 2 doses give us some protection against being hospitalised or dying from COVID, but it doesn't give us excellent protection against getting ill. What that booster dose does is it actually helps us from being as sick. You can still get COVID, you can still feel sick, but you're unlikely to be sick enough to go into hospital. But you're also less likely to be able to give it to somebody else for as long, and you're less likely to give it to somebody else. So you're slightly less likely to catch it, slightly less likely to give it to someone else, but it gives you really good protection against for you yourself against needing hospital care or dying from COVID. So it's really important that as we've learned, we hoped at the beginning 2 doses was going to be it. We've looked at the research, we've looked at the evidence, and we have learned that we need to do this booster. And so that's why it's been mandated in New South Wales for disability workers. So people should already, hopefully, be up to their 3rd dose. But if they haven't, they've got until June the 1st to have that dose, unless they've had a recent COVID infection, in which case there's an exemption for the next 3 months because our technical advisory group on immunisation has said, if you've just had COVID, wait 3 months until you get your next dose of a vaccine. So really important, though, that people understand this is not just something that we pulled out of a hat. This is something that we have been looking at and learning. And I think it'd be worse for us to have information and not act on it, even though it changes a message that we had, than it is for us to tell people why we've changed and how we've changed.
It's really interesting that you said that the booster is, I guess, effective on the 2 fronts that we've talked about before, which is not only effective in stopping you get it or be seriously ill, but also stopping you in transmitting it or reducing the likelihood, I guess, because there is still such wide transmission. So is that, I assume that's based on evidence that that's the case?
So if you've been boosted, you can still get it. You can still give it to other people, but it reduces that risk by about 10%. Now, that might not sound like a lot, but when you're particularly caring for people who are very vulnerable, that reduction is really important in trying to help their safety. It's a bit like when we're in a car, we don't just have a seatbelt now, we try and have an airbag as well. Now, for many years, the seatbelts were, first of all, it's controversial to have seatbelts, and seatbelts were good. And now most of us would like to have anti-lock brakes, an airbag, and a seatbelt. And it's not that the seatbelts don't do good work, it's just that we've learned and we've got new technology to help us understand. And it's that same sort of information that helps us understand what's happening. Even when we get new strains, we keep looking to see. And it's true, they're not as effective in cutting transmission as they were against, the alpha virus or the original virus. But even that small reduction is really important in protecting other people. But there's that huge benefit to yourself, I think, is the other thing. It's not like you're just getting vaccinated to protect someone else. You actually do protect yourself. And part of that also means that for our healthcare system, which everyone knows was under incredible strain back in, December, January, when we had that big Omicron wave, it means that we're less likely to put the healthcare system under stress as well.
Yeah. Okay, well, we've had, as the Union for the Disability Sector in New South Wales, we have had a lot of questions from members that are around the effectiveness of boosters or the requirement to have them, and some concerns that members have about how they can comply with this. And I'd love to put some of those to you, just to get some responses for our members. One of the questions is around I know you sort of covered it, but it's probably good to go over it a bit again, which is we were told that 2 was enough. Now it's a 3rd to be fully vaccinated. Does that mean that if you've only had 2, you're not fully vaccinated? And does this mean that is it going to then be an extra booster, or how many of these will we need? Is it that there'll be a certain course and that's it, you're covered for life? Or is this something where we're going to need more boosters or more doses?
Yeah, so I think this is one of the things that we've been learning, and I'm completely upfront in saying this is something that we have learnt about COVID. So our initial hopes were that primary course of immunisation would give us a very long-lasting protection. Now, there's some evidence that it does give us good protection against some of those very severe outcomes, but it's not as good as if we have that third dose, that booster. Next question is, do we need to keep on having boosters? Will we need to keep being vaccinated over and over again? I think some of the best examples of what's happening with different people with their own individual risk is some of the guidance that's out there at the moment. So, for example, if you have severe immunocompromise, so you've had a transplant, you were born without a great immune system, at the moment, you'd be up to potentially your 5th dose of vaccine to stay up to date. And that's simply because you've had so much immune suppression that your immune system that needs to be activated by the vaccine is just not very good at being activated because you're on medications or you're born without that facility. So those people are having more regular vaccines. Older Australians, people over the age, who are older. Again, they've often had 3 doses by now and they're being recommended to have a winter booster. Why? Because as we get older, our immune system is less good at responding to vaccines. Now, if we look at young people, aged up to 16, the recommendation is that they don't have a booster because the protection they're getting from those first 2 doses is enough to help see them through for the foreseeable future. Now, for the rest of us adults, the recommendation is to have a booster. Why? Because across our population, whilst there'd still be some people who were protected and quite well protected after 2 doses, we know that across our population, most people's immunity will be starting to sort of slide a bit. And what that means is that whilst they'll still have some protection against hospitalisation and death, those protections against transmission, catching it, even just having to have a few days in bed feeling absolutely awful are starting to decrease. And so that booster will help, really boost our immune system. That's why it's called a booster, our immune response to COVID, so that when we do meet the virus, we're less likely to be sick. Doesn't mean we won't be sick, less likely to be sick, far less likely to be hospitalised. You will see people who have been boosted who will wind up in hospital because no vaccine is 100% effective 100% of the time, but the risk is dramatically reduced.
And in terms of the boosters that are available, it's still the case that as of May 11, it's just Moderna and Pfizer, is that right, that you can use as a booster? Or can you do Astra or Novavax? And is there any, are they likely to change?
So the strongly recommended boosters are the Moderna or the Pfizer. But if for whatever reason you can't take those doses, talk to your GP and you can have the Novavax or the AstraZeneca if there's a particular reason. So I guess the thing is, if you think, I'm not sure that I want to have that brand again, one, you could change brands within whatever you had next. Some people find that there's not much of a difference. Other people feel better having the same brand because they already know what they've had. Otherwise, they can go to a different type of vaccine, such as the Novavax. If you felt unwell after having the first doses, that's not unusual. That's simply your immune system learning how to respond to the vaccine. And if it's been some time since you had that second dose, you're less likely to have those side effects again.
And that's something I wanted to ask you as well, because we have had that from a lot of members who did have a particular reaction to the second dose, which I think was commonly reported for some of the mRNA vaccines. The second doses for them, for some people, was more of a reaction than the first. And some of our members did have to take a few days off work, and it was quite a, that it was a rough time for them.
It was an ordeal.
And so, and they're a bit stressed about that again. So what's the evidence of the reaction to third doses? Is it because it was quite a marked experience for many people, I understand, of that second dose for the mRNA? Is that the same in third? Is there any data around that or around the reaction to third doses?
Yeah, so what you'll see is that gradually we're ATAGI are going back to increasing those periods of time between the doses of different vaccines, and that is the more doses we've had close together, the more likely we were to have those side effects. So a lot of us had only 3 weeks between dose 1 and dose 2 because we were trying to get ourselves protected as quickly as possible when that Delta strain was there. And our immune systems were on fire. So a lot of us got headaches, some of us got dizzy and felt unwell for a couple of days. It wore off after 2 or 3 days, but it was not a fun experience. And I'll put my hand up to say I did not have a fun experience. But that time that we've had since that second dose means that our immune system will get reminded, but it won't react quite so spectacularly excitedly. So there's fewer side effects, less risk of side effects with that third dose. And we do have that information to hand. And that's why, at the moment, if you were about to start your vaccine journey, we'd probably be saying 8 weeks before your first 2 doses. So again, we are learning. And that's the thing that I really want to emphasize to people. It's not that we're changing our mind all the time for no good reason. It's because we get the evidence from overseas. We look at our own evidence here. We have a really good surveillance system for side effects. Anyone who got vaccinated in one of the New South Wales health clinics probably even got a side effects survey after they had it. And if you just texted it back, that information's all been collected and it's all publicly available. So if you're concerned, what's the information that people are getting? The TGA does weekly reports, and our Australian Technical Advisory Group on Immunisation also gives reports where it talks about things that people are reporting. And we've all got to remember, one of the classic story is I got vaccinated, then 2 days, especially at the moment when we've got so much respiratory illness circulating, I got vaccinated and 2 days later I had the flu. And it's just because we've got so much flu going around at the moment. It's not that the vaccine causes flu, it's just that if you've got a lot of respiratory illness going on at a particular time, it's not uncommon for you to get vaccinated and then be ill in the following week, because it would have happened whether you'd been vaccinated or not.
The other, in the context of this year and the Omicron wave and so many cases of COVID now, a lot of our members have had their 2 doses and then they got COVID over the summer period.
Yep.
And they've said to us, well, why do I need a third? I mean, I got through COVID. It was actually not that bad. And I've had it now. Like, do I really need, aren't I immune? Do I really need another dose?
Yeah. And one of the things that we've learned is that sometimes having had COVID before doesn't protect you against the new strain, but for whatever reason, the vaccines do help protect you against the new strain. So one of the things that, even though you got COVID, you may not have realized is it kept you out of hospital. If we'd had that epidemic back when hardly anybody was vaccinated, we would have been like New York or the UK back in 2020, where the hospitals were overflowing, we were running out of ventilators, we were running out of oxygen. So we never were in that position, which is wonderful. So even though some people got sick, what we know is that different people will have different responses to actually getting sick, and the vaccine actually is much more likely to give us reproducible immunity into the future. And what they're seeing overseas, the initial thing was people who'd had Delta and hadn't been vaccinated still got sick with Omicron. And now there's a thing with, if you got BA1, how well protected will you be against BA2, the new strains of Omicron, or even BA4 and BA5? COVID's a bit of a nasty virus at the moment. It just keeps finding new ways of changing. And so whilst it also means that our vaccines aren't quite as effective as they were at the beginning, it also means that if you've been infected by COVID before, that protection's not as good as it is into the future. And so it's that combination to some extent. If you've been vaccinated, had COVID, don't recommend catching COVID. COVID is a nasty, nasty virus that in most people will cause a really mild illness, but in some people will cause things like, not just the lung infection, but things like strokes, kidney failures, clots to the lungs, clots to the head. It's a really nasty virus when it decides to have a go at you. And so I really do not recommend catching wild COVID if you could be protected by immunisation instead.
The other thing with so much COVID circulating is that a lot of our members have it right now or very recently, just recovered. They might be in isolation or just recently out of isolation. So what's the advice for them? And does because the June 1 exemption is fast approaching, if they haven't had their third dose, do they need to get it before June 1? Or if you're currently in the period of recovery or having just had it, what do they need to do? Or when are they eligible?
So go and see your GP. At the moment, our advisory group on immunisation says wait 3 months before you have your next dose of a COVID vaccine if you're due. So if you've only had 2 doses, you're just getting over COVID, the exemption is for 3 months. Go and see your GP, have a talk to them about waiting 3 months or not. You might have very particular health circumstances that might mean your GP says, no, bring it forward, winter's coming. Yep. So they can put an entry onto your COVID vaccination record to say you're exempt until 3 months afterwards. And then generally speaking, you've got 4 weeks after that expiry date, because we know sometimes somebody's on holiday or something else is going on. So you've got a 4-week grace period after that exemption expires. But generally speaking, talk to your GP, get some guidance from them about what the next step is for you. And you can negotiate what you're going to do, even make your appointment for when you're going to get that vaccine, even in 2 or 3 months.
So, and also for our members who might be having their booster scheduled, you know, in the next week or 2 before the June 1, I assume if they then don't get COVID before, then they should talk to their GP about then what to do.
Absolutely. So I think that's the thing, that there's a general understanding that we've changed from 4 to 6 weeks or get your booster as soon as you've got over COVID to saying 3 months is better. And this is, again, we're learning. Sometimes we want things closer together. Sometimes we want things further apart. I know it's really confusing at times, but it's because we're learning, and that's why it's now 3 months. And so go and talk to your GP about that.
Well, thank you, Dr. Fizzell. This has been a really informative discussion. I guess before we finish up, are there other particular points you'd like to emphasise to workers in the disability sector based on the conversations you're having with lots of different people about why getting boosted having that third dose is so important and will make a difference?
Look, I think one of the things I'd really like to say is thank you, because the workers in disability have gone above and beyond the level of care for so many of their clients with COVID. I've seen people go in and look after people with COVID, even putting themselves at risk at times because they knew that the client wouldn't look, you know, had really bonded with particular carers. So we know it's been a difficult time over the last 2 years. You know, you haven't been able to take your clients out on the excursions they might have liked. You haven't been able to do the things that you would have liked to have done with your clients. This winter could still be a fairly bumpy winter, and we want you to be protected and we want your clients to be protected as well. So we'd suggest very strongly that you get your flu vaccine. Your flu vaccine won't protect you against COVID, and your COVID vaccine won't protect you against flu. So please consider getting your flu vaccination. Strongly recommend that. And again, that booster, that recommendation hasn't been made just, you know, because we want to annoy people who've been doing such an amazing job. We really want to protect you, and we want to protect those clients that you care so much about. So please, if you've got uncertainties, if you've got concerns, if you've read something on the internet, go and talk to your GP, because there's a lot of misinformation out there. You know, and it's that thing, you know, we really want you to be protected. We want your clients to be protected. So please go and talk to your GP and really go through those things that you're concerned about with them.
Thank you so much again, Dr. Fizzell, for your time today in answering questions from our members about the third dose or booster of the COVID vaccine for disability sector workers in New South Wales. And thank you for all the work that you're doing at New South Wales Health in keeping us informed and safe as well throughout the pandemic. As the doctor just mentioned, if you do have further questions, see your GP. That's the best place to get medical advice. And there are a lot of resources also on the New South Wales Health website and the Commonwealth Health website. If you've got questions about this impact on your work or employment related questions, of course, you can speak to us at your union at the ASU, but we can't give you medical advice, not trained to do that. Do see your GP with any questions relating to those things. And thank you once again, Dr. Fizzell and everyone, and have a safe winter. Thank you.